All right. Good morning, everyone. Thank you so much for tuning into today's webinar, and welcome to those who are also going to be viewing this webinar at a later date. I'm very excited today that we're going to be talking about access across America. This is a year-end reflection on women's health policy. My name is Mia Keeys, and I serve as the Director of Federal Affairs for Hologic, the Women's Health and Innovation Company. And we're so excited today to be having this conversation, not only with you, virtual audience, and those who are live, but also with two incredible resources and women who are not only stellar in their positions with respect to women's health and policy and health policy overall, but I must also admit that this is quite a pleasure because these two women are really great friends and people who I've walked alongside in really critical moments of America's history with respect to health policy, both post-COVID and pre-COVID. And I'm so very excited to welcome both of them here today. So first, I'll introduce Ms. Hillary Beard, who currently serves as the Chief of Staff to Congresswoman Terri Sewell, who is out of the state of Alabama. And I had the pleasure of working with Hillary for a number of years, both when we were advising our respective members of Congress. At the time, I was working for Congresswoman Robin Kelly as her health policy advisor, and Hillary and I were very much hand in hand in the work that our members were doing. And then as fellow chiefs later on, and she's currently Ms. Sewell's chief. And so Hillary, welcome to today's webinar. I can't wait to really pull out your expertise with respect to rural health and women's health here. And of course, I want to also mention Ashley Southerland, who, as I mentioned, is not only just an incredible woman and just a force and in what she does and who she is, but she currently serves as the vice president and the deputy general counsel at Homeward Health. And I also call her a great friend. We had the pleasure of working together in the past with the American Medical Association. And again, very critical times with respect to population health here in the United States and, of course, all over with respect to the pandemic. But today, as I mentioned, we are going to be uplifting rural health at the intersection of women's health. And so I want to invite both of them onto the, well, here they are, actually. I see you all. Very nice to see your smiling faces, Ashley and Hillary. Let's just jump right in. So this has been, I cannot believe we're essentially at the end of the year. And this has been quite a year, to say the least, right? And we have so much to look forward to, but also to be potentially mindful of and critical of as we're moving into this next year, this next second session of the 117th now, Hillary, Congress. And we have so much that we need to be able to do just as public health and policy experts. And so I want to ask you all, as we're looking back on this last year, what are major milestones or major policy successes that have occurred with respect to women's health? And I'll invite both of you to come on. Hillary, let's start with you.
Great. Thank you so much, Mia. It's always a honor and a privilege to be with you. And I just want to say that I learned so much from you whenever I was a younger staffer handling healthcare. And it truly was an honor to work with you. So it's good to be with you today. So I will say that this year, while we have had divided government, I think that we have made a lot of advances whenever it comes to women's health, reproductive health, and all the rest. I'll say that just the past couple of weeks, we've gotten great news out of North Carolina. North Carolina expanded Medicaid. And so now we're down to just 10 states that have not yet expanded Medicaid. And of all the areas that Medicaid expansion helps, I think that women's health and reproductive health is at the top of the list. So that is a big deal. We are starting to see a lot of the money from the CARES Act and from all of these bills that we passed during the COVID pandemic, from the IRA, from the infrastructure bill, even flowing down into our communities. In September, HHS, on the Maternal Health Day of Action, the Biden-Harris administration announced more than $103 million for initiatives to address the maternal health crisis. So a lot of that money is flowing down into our communities, and hopefully we can make sure that the most underserved communities get access to that money.
I really appreciate that you've laid out, these three major bill initiatives and that are now law, and the fact that they are still impacting today are critical. And so, Ashley, I want to bring you into the conversation. Same question. Looking back on this last year, what sticks out to you in terms of milestones?
Absolutely. Amia, thank you as always for the conversation and the question. I think as someone who's outside kind of in the industry, a lot of the things that we're tracking are the same things that Hillary is focused on. So what expansion is happening in various states, what infrastructure is being put in place to support the work that we're doing to provide access to individuals in rural communities. And so the more support we have from the federal government, then that trickles down to the states or even states individually. And that helps bolster the work that we're doing. So I think, to the point around the operationalization or kind of seeing that money flowing into various communities from the Blueprint for Maternal Health, which was passed in 2022. And now we're seeing kind of that work show up in the state. So even a number of states have expanded, for example, access to doulas in Medicaid. And so that's something that, while right now we serve Medicare beneficiaries, it's something that we're absolutely tracking in terms of what infrastructure and what support is available for us. I think we're also, tracking the funding for like Black maternal health that happened in April. So things that, again, kind of supporting the work that we're doing and, continuing to see the expansion in Medicaid. So a lot of great things that are happening, making sure we're operationalizing and the support and kind of the research initiatives that are supporting all that work. So a lot of good stuff happened this year.
Yes, a lot of good things indeed. And as someone who loves Christmas time, if I were to put some things on my Christmas list, I'd have a lot, in terms of what realities we really need to consider moving forward, And so both of you have talked about funding. You've mentioned the expansion of Medicaid and what that means in terms of not just the health of women in the nation, but really also that bears on families, right? And, you actually just mentioned and brought in very quickly the research angle. What other realities do we need to consider as we're moving forward? Where are the opportunities for advancing the health of women in terms of equity of access, equity of quality care? Next year, what do we need to look at?
I'll jump in and say, I think continued funding. So, where is the money being sent, and where are there, opportunities? So I think, as I mentioned, research, and not just is the funding there for the research, but, the leadership that's there, the people who are leading those initiatives, really centering the voices of women and birthing people, and the various opportunities. I think from an innovation standpoint, making sure that it's not just innovation for innovation's sake, right? We want to make sure that we're not doing harm in communities as we are kind of expanding research, as we are looking to develop tools and solutions that are actually going to center women and women's healthcare, making sure that that's done in a way that is equitable, making sure that there's not a misuse of data, for example, because a lot of this work is going to be centered on data best practices, privacy. And I think as we see tools like artificial intelligence being brought in, making sure that there's no misuse happening of that data in order to kind of build the solutions that are necessary. So I think those for me are major focus areas and things that we're taking a look at as a kind of a technology-enabled healthcare provider.
I will add that I'm going to put in the chat the announcement about the funding that I mentioned earlier. So what we need to do as leaders in this space is making sure that grant makers that we know and organizations that we know in our communities are applying for this funding. So we've got to stay on top of that. I put the announcement for that funding in the chat. And that money, just to be clear, is for entities, hospitals, nonprofit organizations, and all the rest to apply for. And so that's really important to know. And another thing, the White House announced in November the first ever initiative on women's health research. And as Ashley mentioned earlier about innovation for innovation's sake, we want this to not just be research for research's sake, because oftentimes the most underserved communities can really be harmed by just, research without actual deliverables on the back end. So part of that initiative, the White House has said that within 45 days, the members of the initiative will recommend concrete actions that the Biden-Harris administration can take to improve how research on women's health is conducted and maximize the administration's investments in women's health research, including to address health disparities and equity. So that 45-day mark, I believe, is coming up next week. So I know that in our office, and I'm sure from many of you will be waiting anxiously to see what those recommendations are and to make sure that they actually have teeth. So yeah, I think that that'll be really important. And then I mentioned something that I really hope to see in 2024 is more states expand Medicaid. In Alabama, we have a labor and delivery unit crisis where we're seeing more and more labor and delivery units close. We only have, I think, like a quarter of our rural counties still have labor and delivery units. And we have one in our district in Clark County that is on the verge of closing now. It's the only labor and delivery unit in the region. And they each year deliver babies at a $950,000 deficit, all because of the labor and delivery unit. And part of that is because Alabama hasn't expanded Medicaid. I think it's 75% of births in Alabama roundabout are Medicaid births. And so the hospital's not getting reimbursed for those births. And so we're doing everything we can to keep that labor and delivery unit open for the community and for the broader region so that women don't have to travel 3 hours just to get adequate prenatal care, much less to deliver a baby. So yeah, Medicaid expansion would really move the needle for a lot of these communities in red states and rural communities across the country.
I want to stick with that a bit, Hillary, because, I was, to your point about the closure of labor and delivery units, I was just reading an article about that yesterday, and if I'm not mistaken, 3 across the state of Alabama are slated to close before the end of this year or by the next quarter.
That's right. By the end of the year. And as a matter of fact, I think just one of these is in a rural community. 2 are in suburban communities. 1 is in the wealthiest county in Alabama. So, if they're having, it's Shelby County, I believe, if they're having these issues, then we know how dire it is for our rural communities.
No doubt about that. And I want to stay on that same theme there. Ashley, you and I are mothers, our babies play together. They were just playing together yesterday, and we had a lot of fun watching them. But what does this mean for birthing people? What does this mean for mothers? And not even just Medicaid recipients. I like to, especially because you all at Homeward work predominantly as a provider for rural health populations. Medicaid is a major part of that, but there are many others who are privately insured. So talk to us about what that means for aspiring mothers, birthing peoples, and families on Medicaid.
Yeah, absolutely. I mean, closures are difficult, for anyway. That's the loss of infrastructure, I think, impacts all families at all levels. And so, we primarily serve Medicare beneficiaries now, but there's still well women visits, for example, that are necessary for the populations that we serve, and even those under age 65 from who are disabled. So I think that loss of infrastructure is incredibly difficult. A lot of the work that we do is to provide care where people are. So there is a modality where we are going into homes and providing care if that's what's needed, for those who are homebound or for those who don't have access. Rides are an issue. So I think the example of the closure of the hospitals is just kind of a broader example for the failing infrastructures in a lot of rural communities that are it's more difficult in those communities in particular. So are there ways that we can expand the services that we're providing? There's always looking at that. Are there ways that we can better connect individuals, the patients that we serve, to those healthcare services, and even things outside of just direct office visits, but connection with groceries, for example, or rides. So we're looking to kind of wrap around patients, but that gets harder and harder as various facilities continue to close. There's no referral options, those types of things. So options become limited, and we're working to combat that.
Hillary, to that point about limited options and all that Ashley mentioned, one of the things I've always respected about Miss Sewell and your office and the work that you all do together is she is a Democratic member and works so very much in a not just a friendly way, but a respectful way and an effective way with her fellow members of Congress who are Republican members. what does this conversation mean in a bipartisan manner, you know, especially in a state where Medicaid is not expanded?
Yes, absolutely. So we work every day with members of the congressional delegation in Alabama. We're the only Democrat in the delegation, and there are 6 Republicans and then 2 Republican senators. And so we have to find ways to be creative and get around our policy disagreements on things like reproductive health and Medicaid expansion to really, like I said, be creative about solutions that on the periphery of those issues. So we, Congressman Adderholt, who is chair of the Labor HHS committee, he represents a district to the north of my boss, and we work together with his office often on solutions for our rural hospitals. So often his office will come to us to ask, you know, what did y'all do to keep this rural hospital open? We'll get on calls together with the governor's office to try to encourage them to help with Medicaid reimbursement policy and all kinds of things like that to keep the hospitals open. So so healthcare is an area where we really try to do a lot together. And yeah.
That speaks volumes to not only to your boss's work, but to yours as well, right? It's quite an office there, and I'm so very proud of the work that you all are doing. I'm wondering, Hillary, if you wouldn't mind briefly offering, for those in the audience who don't necessarily advocate from one political perspective or another, or those who tend to speak only to Democratic members, those who tend to speak to Republican members, what would you say in terms of what language works, what advocacy works when speaking to various members of Congress, specifically about issues pertaining to rural health or to the health of women, namely in rural areas?
Yes, so I think that this is one of the women's health, again, outside of the reproductive health space, the abortion conversation is one of the last frontiers where we can really get bipartisan work done. And so I think in terms of when talking to Republicans, we've been able to get so much done with them on the Ways and Means Committee because my boss represents both rural and urban communities. We work with them on rural health because so many of them represent rural communities. Our district is a majority minority district in Alabama. We have Birmingham, Tuscaloosa, Selma, Montgomery, and then 9 completely rural counties in between. So we have a lot of similarities with Jason Smith, who is the chair of the Ways and Means Committee. His district, while majority white, also has a lot of the same economic challenges that we have. So we try to just get, we have a very basic understanding of the similarities between our districts in terms of socioeconomic issues. So we focus on rural health, on women's health, on veterans, so that we can bridge those divides and get things done.
And we all know how necessary it is to get things done. You know, there's not always going to be complete agreement across issues, other than the fact that people are dying. We can do something about it in various ways, and this is how we really need to activate that, right? But one of the things I think that we certainly do all agree on is that there has to be more done to address conditions that disproportionately affect women, that differently affect women, and there is no single answer or single area of focus to really hone in on. And so, from your perspectives, how can we continue to make progress with respect to improving women's health, crafting policies that reflect the diversity of experience, really working on measures that uplift the needs that women face in communities across the country?
One more thing that I'll add to kind of piggyback off of my last answer, and then lead into this one, is another thing that we've been able to make progress on is with Republicans is through public-private partnerships. They're big fans of those, as are we whenever consumers and patients are protected. So I guess smart public-private partnerships. But something that we've been talking about for years is transportation and the intersection of transportation and rural health. We get calls in our office often from constituents who can't get to the doctor's office or can't get to the pharmacy because they don't have a ride. At the end of the month, their Social Security check has run out, and they usually, a lot of older folks in our district will pay people in the neighborhood to take them to the doctor if their family is not available. Well, they're like I said, their Social Security check has run out at the end of the month, and they need to get to the pharmacy or they need to get to the doctor, and they can't get there. And so then they end up in the emergency room. Well, the same goes for women in these communities. And if their car is broken down or they don't have a car and they can't get to their prenatal appointments, that has long-term implications for the health of their of themselves and their babies. So transportation is an area where we've had some promising conversations with Republicans whenever it comes to medical Uber and these kinds of things, and figuring out how we can expand medical Uber and Lyft into rural communities, because it's not going to work. Medical Uber isn't going to work currently in rural communities because there is no Uber there, you know. So that's something that's been a long-term conversation that we're continuing to build on. And we hope to actually get something done in 2024 on that.
Yeah, I echo everything that Hillary said, you know, to the point around transportation and long distances. And so that's part of why our model is, if necessary, going into the home for those who qualify. I would also add that, you know, in terms of like, how can we be better in the coming years? I think continuing to center the voices of women and birthing people, kind of believing like, is this a problem that needs to be solved because individuals have identified it who actually are from the communities, who are part of the communities who are experiencing those issues, and then kind of diving in that way. I think also, like we've talked about funding, I think, over and over, and so I think, you know, what Hillary dropped in the chat is really helpful information to have. And then there's also kind of understanding that the populations that we serve are not a monolith, and so you know, the reality of some of the things that we've faced is like, hey, well, remote patient monitoring might be great in certain areas, but if someone only has a landline that goes 25 miles, that's something that's going to be a completely different deployment solution that has to be you know, worked around for that. So I think continuing to challenge assumptions, you know, about what might work in urban areas versus rural areas, and kind of bridge that gap, but then also making sure that we are centering the voices of those who are going to be impacted the most, and like kind of lifting them up and then funding those voices.
Yes, indeed. And speaking of the chat, because you first of all, you both are giving us such jewels, and I'm hoping that those in the audience are taking notes, but then otherwise know that you can come back and watch this and share this information with those who aren't present today. Please share the link. And beyond that, we want you to also right now share any questions that you have. So if you have questions, audience members, please drop your questions in the Q&A, which you should be able to find right at the bottom of your screen. And then if anything that Ashley and Hillary are saying is resonating with you, certainly comment on that within the chat box. So questions in Q&A, and I'll take those in a few minutes, and your comments in the chat box, because they might be able to uplift something that you'd like for them to mention within their comments. So ladies, I have a few more questions for you before I turn to audience questions. You know, we're talking today about the impact of policies, the impact of funding. What have you learned this year? You know, what has worked well, what hasn't worked well? How can we, as we're moving into this next year, 2024, bring forward those lessons, those best practices, additional questions that we might have with respect to advocating continuously for women and for families? Ashley, let's start with you.
Yeah, sure, happy to start. So I think, as I mentioned, you know, not the assumptions about what works in certain communities versus not. I think we, you know, are also thinking a lot about the interconnectedness of the issues that we're trying to solve. So, of course, we've talked about like healthcare. There's the social determinants of health, but then things that we're solving for, like loneliness in the populations that we serve, which are much more about the human condition, kind of the need for community, which are not, you know, healthcare directed, but are just as important in terms of the work work that we're doing and what we're trying to solve. So I think being open to learning as we, treat the patients that we're serving, and then reflecting that back to them in terms of the work that we're doing. So we hear you, we will take in kind of what is a need that maybe we didn't know existed before, and then turn that around and do our best to either connect you with services or to provide those services directly. And to the point on interconnectedness, I kind of think about spaghetti versus waffles, right? Like waffles, we're solving for kind of individual things at sometimes, but the work that we're doing is much more like spaghetti. And so how do we, fully understand like what threads to pull, what is something, again, that maybe we didn't know going into the conversation, and then reflect that back to the community, but always assuming that, this is a spaghetti issue, not a waffle issue. So.
This is language from a toddler mom and older baby mom, but I love that resonates. What threads to pull compared to overarching large swath applications of issue directed problems. Yeah, so Hillary, same question.
Yes, I love that analogy. So I will say that what didn't work in 2023 was dysfunction in Congress. That certainly didn't help us get a spending bill with increases to a lot of programs that people rely on every day passed. And so our hope is that the current CR, continuing resolution, expires in January, and our hope is that we can get a true omnibus pass or minibus or whatever it is, so that these programs will get funded at the levels that are needed. So many of our communities rely on programs from Head Start to LIHEAP, which helps people afford their electricity and heating. That's a critical program in so many communities, from, like I mentioned, Missouri earlier, rural Missouri to rural Alabama. Communities rely on those programs. So the hope, like I said, is that we can get past all of this dysfunction and pass a bill in January that includes increases for these programs. So yeah, I would say in my world, that's what didn't work.
Yeah, yes, that did not work.
That did not work.
I have a follow-up to that, but Ashley, do you have anything to also add to that?
No, I mean, I think the overarching, thought for us is like, one of the things I said around like the spaghetti versus waffles and understanding communities, but also kind of checking your privilege too, because I think as sometimes we don't want to talk at communities, we want to involve them in the conversation as much as possible. And kind of the point I raised earlier about, do no harm. How do we make sure that we're going in and actually in the form of service and not kind of dictating a solution that's necessary. So I think innovation and weaving in technology is going to be necessary, since there's provider shortages that are especially prevalent in rural communities, but making sure that it is in collaboration, not kind of a paternalistic way.
Yes, was what I said, and you didn't hear me because I was muted. Hillary, I have a question for you. But before I raise this question from the audience member, I'm wondering if you can briefly walk us through, what the appropriations process generally looks like right now, especially post-COVID. Some things have changed since pre-COVID. And I want you to mention that because there are some people who are not congressional staffers attending today's webinar. And I really want people to make sure that a main takeaway is it isn't just that Congress legislates. There are other things that Congress does that are relevant to this conversation.
That's right. So sorry I didn't clarify earlier. I should have done that. So the appropriations process, the fiscal year ends on September 30th. And if Congress does not pass a budget by September 30th, they have to pass, either the government shuts down or they have to pass what's called a continuing resolution to keep government open, or a full budget. But so this year we've extended it twice. We came really close to having a shutdown in September. We extended it. We didn't come as close to shutting down that time, but we extended it through January. So the cycle typically starts in the first quarter. We start working on appropriations letters, where we write letters to the appropriations committees about our priorities. So take, for example, I mentioned the program earlier, the LIHEAP program or Head Start. So there's a member of Congress every year that leads the effort on each of those issues. I can't remember which two they are, but then a bunch of members jump on those letters to encourage the appropriations committee to fully fund or fund an increase in those accounts. And so then the appropriations committees do their work for a couple of months, and then the way regular order is supposed to, by September 30th, all of the committees are supposed to have marked up those bills, and then they're supposed to go to the floor and be voted on and passed by themselves by September 30th. That has not happened as long as I've been here. It hasn't happened. I think it has not happened in 20 years. So anyway, that's the way that the cycle is supposed to start. A lot of interest groups and stakeholder groups and nonprofits and all of this come up to DC in the first quarter to lobby for their various programs. So some of this funding goes to rural hospitals, some of it goes to nonprofits, like I mentioned earlier. Some of it goes to colleges, like the TRIO program and Upward Bound and those programs. But so much of the and I think Congress does not do a good job of explaining all of the different programs that are impacted by this process every year. So yeah, that is the way it works. I don't know if that was a good way.
No, that was a very comprehensive way to explain it. And this is why, it's so imperative that for constituents, you first and foremost know who your member of Congress is. And it would be great if you also know their lead health staffer or at the very least their chief of staff's name, because by forming a working relationship with that office, you'd then be primely positioned to raise your priorities especially in this case with respect to rural health and women's health, and say, hey, dear member of Congress, dear Miss Beard, these are the issues that are relevant to my organization, that are relevant to the community that this organization represents. We would like to submit for evaluation an application for what used to be called earmarks, but community project funding, to be considered during the appropriations process, to be set aside to support our related issue to rural health, to women's health. And that ought to happen before, Hillary, would you agree, before the end of the year, so that as you're moving into the top of the year, members of Congress are mindful of who they want to and what priorities they want to bring to the Appropriations Committee's attention.
That's exactly right. Yes, it's a year-long, it's a 24/7 process. So the earlier you can get to your members of Congress and tell them about the programs that matter to you, the better. And I'll add that the labor HHS, which that is the biggest appropriations bill, because it includes the largest portfolio outside of defense. I mean, defense is, we spend a lot of money on defense. So, but labor HHS, that subcommittee includes Department of Labor, Department of Health and Human Services, and Department of Education. So as you can imagine, that is a huge comprehensive bill. And so the ranking member of that committee is Rosa DeLauro, who is also ranking member of the full committee. So she's the top Democrat on the appropriations. And there's so many different programs that are funded through labor HHS. There's the screening and treatment for maternal mental health and substance use disorders program. There's the maternal mental health hotline. There's the maternal health workforce programs like community-based doulas and loan repayment initiatives for nurses, state maternal health innovation programs. So those are just a few of the programs that are funded through this process, and that have to be reauthorized each year, reappropriated each year.
And I'm going to give you a question, Hillary, that I'd like for you to please answer after I bring Ashley in. One of the audience members and probably several are wondering, what has Congress done to support rural hospitals in their struggle? What could be done moving forward, especially because you mentioned the issue of hospital closures, and particularly the impact of the closing of obstetrical units. And so as you think about that, Ashley, I want to ask you, when you're thinking from your current perspective, and even in past perspectives, because you are a past litigator, you've worked for the American Medical Association. You currently work specifically for a provider organization looking at rural health. What does the conversation around appropriations mean to your work, to your field? How is it that you all navigate that and uplift the issues that matter to rural health?
Absolutely. So as part of our, we're an early stage company, so I wear many hats, HR and Gov Affairs and policy being more of them. So, we are constantly tracking the process that Hillary described. So at what point does it make the most sense to have conversations, meetings with various individuals in the states where we serve patients and beneficiaries? So Michigan is one of the states where we provide care. Minnesota is another. And so what things from a policy perspective are going to impact the work that we're doing, but also lift up the needs of the communities that we're serving. So we very much kind of are tracking that process, the appropriations process and the conversations that have to happen. As well as, are there other levers outside of Congress, but just like agency meetings that will help kind of move things forward. And so we have kind of that coalition building, even those outside of Congress and agencies, but just those in the industry who we may be able to align with or who have similar issues that we can lift up together. So I think it's an ongoing conversation and something that we pay very close attention to, particularly as we don't want the government to shut down. But up until that point, a lot of the work that we're doing definitely is focused on the work that Hillary described.
Thank you for that. And Hillary, so the question that I mentioned before, and I have another one now that I'm just thinking through all the things Ashley just said. I'm going to come right back, Ash. Okay. Hillary, so what's Congress doing in support of rural hospitals?
Yeah, so I will say that the payments that came out during the COVID pandemic in 2022 and in 2021, 2022 were really critical in helping hospitals stay open, but also were underscored our point that we've been making to HHS and to appropriators for a long time, which is that rural hospitals, there really needs to be an emergency fund for rural hospitals, because the model, especially in states with high rural populations, isn't working. And so that we believe that rural hospitals should continue to get emergency payments to be able to stay open. A bill that was passed last year, I think this was in last year's omnibus, which is the big funding bill, at the end of last Congress, included a new designation for rural hospitals, and it's called the Rural Emergency Hospital Designation. It allows hospitals to convert to emergency services only hospitals, so that they can triage folks there in their community and get them where they need to go, but they can make sure that they can stay alive during these bad accidents. So anyway, so the Rural Emergency Hospital Designation is really important. Those COVID payments were critical in keeping hospitals open. Now that we're, a couple of years out from the pandemic, we're starting to see hospitals struggle again like they did prior to the pandemic. So, and it's because that emergency money that they got has gone away. And so we think that means that we need to get more payments and get some more certainty for our hospitals through additional resources. I will say also that USDA provides a lot of support for rural hospitals, both on the financing side and in other ways as well. So USDA is also agriculture. That's agriculture is also a really important piece of the puzzle here that I think can play more of a role in helping our rural hospitals stay open.
And so I know I have a question for Ashley, but Ashley, your last comment there, Hillary, is really it connects even to something that an audience member just brought up. So I would be remiss if I didn't mention that Miss Nancy Brinker is putting a question into the Q&A box. So hello, Miss Brinker, and for those of you who are maybe thinking that you know her name, but you're not putting the connections together, this is the founder of the Susan G. Komen for the Cure organization, and she is also now, and she founded it because she lost a sister to breast cancer in her 30s. And so the organization is named for her sister, Susan, may she rest in peace. But it really galvanized the work that Ms. Brinker is doing and had been doing with Susan G. Komen and is now doing with her organization, the Promise Fund of Florida. They have an FQHC that works with between 80,000 to 100,000 women who are underserved. They also now have an FQHC called Found Care. And one of the things that they model themselves, that they do, and model that works, excuse me, is they have prominent group of patient navigators who help, especially women, navigate their journeys through breast-related health initiatives, through cervical health-related issues, and a source of those wraparound care services that Ashley, you mentioned before. So I'm wondering, do you all have thoughts with respect to patient navigation? And for those in the audience who would like to know more about what Found Care is doing and what Ms. Brinker and her team are doing, I certainly encourage you to visit their website. They're doing incredible work.
Yeah, absolutely. So I think, we've been tracking in terms of like the policy initiatives, the community health integration services that were embedded into the physician fee schedule that was finalized most recently in November. And so those types of services, those connection services, and like actually having payment for individual physicians who provide those services, I think is critical for some of the work that we're doing. So I know that it was happening before, but I think now having reimbursement policies reflect the work that's happening and trying to bolster that in terms of payment is incredibly important. So that was something that was critical to our work. And I think, to the extent that there are also SDOH services that were part of the physician fee schedule as well. So kind of the recognition, one, of the need for the services, or at least payment for the services if they were happening already. And then, I know that there are, large hospitals, rural hospitals, but also like individual providers who need, appropriate reimbursement mechanisms in order to continue to provide these services, I think was great. So again, something that we track and kind of, through the cycle, the physician fee schedule happens every year, but making sure that to the extent that, we comment as needed or, are leveraging the resources that are finalized.
Yeah, it's not a sexy topic, but it is incredibly important, right? The how the physician fee schedule lands. We have a few more minutes here, and Ashley, I want to come back to something that you mentioned earlier. You briefly touched on potentially the role of artificial intelligence and the work that is, and Hillary, as you know, there's a lot of curiosity, I'd say, and questions that members of Congress are raising. But with respect to health, Ashley, how does the application or applications of artificial intelligence, how might that work for the good of rural health and women's health? And what do we need to also potentially be mindful of?
Mm-hmm. I think, a lot of these models are going to be based on large amounts of data. And so I think data hygiene, ensuring that, it's not garbage in, garbage out, but there's the kind of the right focus on the data inputs into, artificial intelligence and models like these. I also think, with rural communities in particular, it's usually a small N, right? There's the potential for re-identification, I think, for certain communities or populations. So making sure that we're accounting for that as well. So I think there's the power for good. I think that, the data on the front end and making sure it's the right level of data, the granularity of data is appropriate for the communities, and that it is in turn, kind of to the point around having the right people at the table, that there are voices from the rural communities who are actually, talking about how this data should be used if and when, and then, kind of brought back to the communities at the end of the day too. If they're providing kind of, data for research, there should be some benefit to those populations and communities as well. So I think there's a lot to think about. The president's executive order, I think, laid the groundwork for a lot of, at least like the next 90 days, I think there's some deadlines in there. So there's a lot of like fast and furious work happening, but making sure that the rural understanding of rural communities and therefore make, the leveraging of those technologies reflects the realities of those communities.
Now, that is certainly a word. And speaking, and thank you so much for uplifting those points there, Ashley. Hillary, when you're talking about, so you've been in the office for insert number of years, right? And you've met all kinds of people, right? both from within your district, but I imagine people who live on the fringes have also come to talk to Ms. Sewell and talk to you all. What kind of voices are helpful? What role of talk to us essentially about the role of advocacy. How do people need to show up in the space of Congress to uplift the issue of women's health in a rural context?
Yeah, I think so. So as I mentioned earlier, my boss's district is, we represent Birmingham, Selma, Tuscaloosa, Montgomery, and 9 rural counties. It's one of the most socioeconomically disadvantaged districts in the country. And so a lot of our constituents they have a hard time reaching Birmingham, much less DC. So, but we always appreciate whenever groups bring patients and nurses and people in their workforce to DC to advocate on whatever issue it may be. We really appreciate and value stories, real life stories about how policies impact people on the ground. So, so I can't speak highly enough of groups that bring their employees and patients to DC to meet with policymakers, and also with when we go to all 14 counties in our district every year for a town hall. And so oftentimes groups like AARP will bring, patients, their members from the community to our town halls, or, a rural health, our FQHC. Thank you, Nancy, for sharing your situation and for all the work that you do. But yes, some of our FQHCs, our local FQHCs will either host an event at one of our FQHCs, or they'll bring their employees to one of our town halls. So that's always helpful as well. And the cancer community does a lot of this. I know that the cancer organizations bring patients to DC a couple of times a year. And so that's also helpful to hear from families from these patient groups that are impacted by the policies that we make. And then I'll add one thing about AI. Sorry to jump back to the last question. We're going to have to be so careful about regulation around AI. It's one of the most critical issues I think that we'll be facing in coming years, because we don't want to slow down innovation in this space, but we want to make sure that our communities are protected. I was just listening to NPR this morning and hearing that there's movement in the AI therapy space. And I'd rather talk to a person for my therapy, but we don't want there to be a situation where lower income communities and underserved communities just get AI instead of a real person, and so those are that they're, in terms of payment models at CMS and HHS, we have to make sure that payment models are appropriately using AI and not overusing AI to determine payment models. Because what works in here in DC or may work in Georgetown isn't going to work in a lot of communities across the country. So we just have to be careful about how AI is implemented with health policy and reimbursement policy. Sorry to jump around, Mia.
No, that was I was going to come back to that anyhow. So both of you, what I appreciate you raising the points about data, Ashley, and you and by data, with respect to health, we're in protecting patient data. We're talking about clinical data. We're talking about intake data. We're talking about electronic records related data. All of that matters to this conversation. And the other thing that I'll mention to bring Hillary's comments in, when you're talking to members of Congress, the data in that case is the story, as you mentioned, right? So all of this is significant to a conversation around how do we really move the hearts and minds of members of Congress to take these stories, to take these data and connect it into legislation that can move and influence the health of not just today, people who are living today, but, quality of health for people to come and generations to come. It's truly, it's a daunting task, but it cannot happen without voices similar to those who are speaking today on this panel, but those who are listening and chiming in terms of the chat and your questions. So we are we have a few more minutes potentially, and I want to be mindful of you all's time. But is there anything else before I ask you a final question that you would like to leave with the audience today? Not in terms of final remarks, but at least thinking about questions that have been posed already. So keep that in mind before I give you this, as I give you this last question, because I want to make sure that we're touching on as much as possible within this space. So, and I'll come back to that in just a few moments. But one of the members here who's attending has talked about the Our Moms program and the success of it across various states. There are now 10 grantees operating in almost the same amount of states. But some grantees, according to Ms. Batstone here, have expressed that they're concerned that they'll lose progress across rural communities once the funding cuts out. And Hillary, you talked about the significance of funding. What recommendations do you have for grantees who are looking for additional funding streams, especially in spaces where funding is so not only critical, but it is time sensitive?
Yeah, so the first thing that I encourage everyone to do, Kristen, in this grantee space, is to call their members of Congress, get your members of Congress the name of their chief of staff and the name of their health policy advisor or health LA, and their legislative director. So you want 3 people. Sometimes the legislative director is the health person. It just varies by office. But anyway, you want to get those 3 names. And I'm going to put this in the chat. And you need to email them and call them now to set up a call, or just send them an email about the importance of extending the Our Moms program or advocating to extend the Our Moms program. So that's the first thing that I would do. And I would have concrete stories about how the program has helped whatever the grantee is survive and thrive during this post-COVID environment. So I think that is the first and most important thing for you to do now, so that members of Congress know going into next year that it's an important program that needs to be protected. Your senators as well. I would also call the senators. So yeah, and then the other thing is, I'm sure as grant, if there are any grant, I don't know, Kristen, if you're a grant maker, or grant writer, but just stay on top of the different funding streams that are coming down that I put in the chat earlier, so that these grantees are also applying for other sources of money in case the Our Moms program is not extended. So yeah, I think that next year is going to be a really difficult year funding wise, because there's not a lot of appetite on the Republican side of the aisle to increase funding for these programs. So we're in a period right now of divided government where they want to cut, we want to increase, and so we're trying to find a middle ground here that doesn't completely decimate our communities that rely on these programs. So I'm hopeful that we'll be able to get some movement on these programs and get some kind of an increase, at least flat funding for 2024.
I think that makes at least 3 of us, who have that same hope. So, but the pressure matters, right? So apply those stories and make sure that your voice is being heard, reaching out to those 3 people that Hillary mentioned: the chief of staff, the legislative director, the health legislative LA, for sure. And working alongside trusted community organizations similar to Homeward Health, and ensuring that you are partnered with people who also have resources in various areas. And so in closing, I want to invite you all to mention some things that you feel are critical. You may have touched on it already, or maybe your thoughts were jarred because you read a question, anything that you have to offer here. And then I do have one final question, and then I'll let you go. I promise.
Sure, I'll start. I think the point I raised around the spaghetti-like nature of the work that we're doing is something that is at the forefront for me going into the new year, and I think something that we all should be kind of focused on. And also, I think trying to understand if there are things that we're not seeing, like what are our blind spots in order to amplify the needs of the communities that we're serving. And I know that I'm sure that all the people on this call do that. But the central nature of like women and people who identify as women to the family and particularly the healthcare unit is so important and something that we've seen. And so how can we continue to lift up women's issues, because it goes to the health of the entire family.
I just want to thank everyone and thank Mia for the work that you do every day. And Ashley, it's a treat to get to meet you today. So yeah.
I'll have to get you two together for sure. And I know we would have a very good time, just as much of a good time in person as we do right here. But one final question. So 2024 is not lost upon anyone that this is also an election year. What does that mean in terms of, especially in your respective spaces, which are influenced by politics? What does that mean working on these issues that are pertinent to women and people who identify as women, birthing peoples, to mothers, to families? What does this conversation mean potentially?
I think it informs the backdrop of our work at all times. I think it creates context. So, understanding if there are certain offices that may be more receptive or not, as from the gov affairs perspective, are there things that are going to be running out, for example, thinking about the telehealth flexibilities at the end of 2024. So are there areas that impact, where we're likely to expend our energies the most, as well as how do we take advantage of or prepare for adjustments in some of the funding and reimbursement that's been provided. So I think it's not central, at least right now, but just informs the context of the conversations that we're having. Absolutely.
Yeah, 100%. And I'll just add that the conversation is so critical to, I mean, everyone is impacted by this, regardless of whether they choose to believe it. If a rural hospital closes down whether it be in an urban area, or if a hospital closes down, whether it be in a rural area or in an urban area, it impacts all of us. So I think, it's a way that we have been able to relate to, we had a major rural wastewater problem in the Black Belt years ago. We still have the problem, but we have been able to get additional resources from USDA and T&I, transportation and infrastructure, those bills to solve this issue. And we were able to do that because we connected with Republican offices who at the time had the majority and had the White House about hunting land. So a lot of them, the chairman of he's now chairman of the Armed Services Committee, but Mike Rogers, his staffer understood the issue because her parents had hunting land in the Black Belt. And so we were able to connect on that, she's like, well, if I'm there and the rural hospital's closed, but this was on wastewater. So she was like, we don't want this issue in the community where we go hunting. So anyway, so it's, it's a constant struggle to find these connections. But we try to do that to make sure that we get the funding and resources that we need to solve these issues. But there's always a connection. And if people wake up and choose to see what the connection is, then that's a good thing. But we're all impacted by it. If you're driving through a rural community or whatnot and the hospital closed, that's going to impact you if something happens.
I think that is a word right there, Hillary, to just close our conversation today. This all impacts us, right? And the thing is, I love that point where you said, if we try to see the connections between us, then we will truly understand why we must move, not just for the sake of ourselves and our families, but for the sake of our neighbor. And if nothing else, COVID certainly taught us that. And certainly women's health, and at the intersection of women's health, at the intersection of rural health is also a similar minded conversation, that everything that happens to us, that happens to our neighbor, as I mentioned. So thank you so very much to my stellar alliance members in this fight with moving forward in equity and health, and ensuring that the the best of us, and especially the best that we have to offer one another is being extended to women, and ensuring that those, especially in rural areas, are being taken care of. Ashley Southerland, who is Vice President and Deputy General Counsel to Homeward Health, thank you very much for being here. Hillary Beard, Chief of Staff to Congresswoman Terri Sewell, thank you so very much for being here as well. And as I mentioned, I'm Mia Keeys with Hologic, and we look forward, audience members, to you all tuning in to future webinars. Thank you very much for you all being here and raising your questions and giving your attention. Please pass this on to those with whom you work and your family members, and tune in next time. Have a great day.
Thank you.